Hello, and welcome to the show Wellness with Hypnosis. My name is Ed Martin, and this show Wellness with Hypnosis is presented to you by the PATH Foundation. And the mission of the PATH Foundation is to help people improve the quality and the length of their lives through the effective use of positive suggestion hypnosis. Now, we've been presenting this show, Wellness with Hypnosis, for a number of years, and we've tried to answer your questions about hypnosis and about hypnotherapy. And one of the questions that has come up over and over again is about how to deal with grief and how maybe hypnosis can help. And I want to introduce Cheryl Martin. And Cheryl, tell us a little bit about yourself and your background. You're an MSW. You're a licensed MSW,
right.
And you've worked with grief for a number of years.
Right. I started with the first hospice that I worked with in 1986. Prior to that, I thought I was really prepared for any type therapy. I have a master's from the University of Alabama, and I was chosen for a program where there were only 32 of us in the treatment program. And had worked in treatment with several psychiatrists here and had worked in adult protective services. In '86, I started with hospice, and I found that grief is a totally different ball game.
Right.
And the information I got there and the training I got there has helped me over the last few years in working with people who are going through different stages of grief, different situations of loss.
Right.
When I was at the first hospice, which was then called New Age Hospice, is now the Hospice of the Medical Center, it was fairly new. The person that I took her place went to another job there within the hospice, and I was really glad because she had trained at St. Christopher's Hospice in England under Dame Cecily Saunders and had a lot of experience, and through working with Elizabeth Kubler-Ross, William Wharton, who is very well known in bereavement work,
right.
and Teresa Rando, I got started with hospice. But I feel like over the years working with the patients themselves has really been the learning experience.
That's where you really learn, working with the client. Now, typically we think of grief as what happens when someone dies, and after they die then we go through the stage of grief. But there's a lot of other aspects to it, and there's a lot of other things that cause grief, aren't there?
Right. Actually, anyone who's been through a chronic illness, we also, the last hospice I worked with, we worked in nursing homes, and the people there had been through years of chronic illness. Their caregivers had been through anticipatory grief, anticipating the loss,
right.
And had gone on a roller coaster ride of up and down emotions. And during that process, it's really important to help people normalize what's happening,
right.
to understand what the norms are, and what that grief is not something that is totally normal. There's a lot of ranges of behavior.
That's true, that's true. And we see people in working with clients as a hypnotherapist, and you're a trained hypnotherapist now, and you've been working with hypnosis now for a number of years.
Right.
And you've worked with many clients, and many of the clients that came to you for other subjects, you found, and I have found, that the true subject that they needed to work on was to resolve or release the grief.
Exactly.
And that many times the symptom or the condition that they have is a direct result of the grief, whatever the source, but some form of grief. And in working with it over the years and working with all the different clients we've worked with, we've seen all kinds of things that are directly attributable to the grief and the sadness and the depression.
Exactly. Kubler-Ross brought everything out about death. I think up until about 1969 in this country, people denied. You know, we were all in existential denial. We thought we would live forever, and let's don't talk about death and dying.
Right.
She, through her work with terminally ill patients, began to help people understand some of the norms and some of the things that happen. But now there's even more information out, a lot of the near-death experience information. and people beginning to talk. In our culture, most of the problems relate to unresolved grief.
That's right. And most people today don't have any idea how to resolve grief.
Okay.
You know, it was an education to me, and I've learned many things from working with you in the past about what grief is and how it affects people. And we've seen, you explained to me all the stages of grief that we go through and how each stage is different and how we transform from that stage into the next stage. And many times people will experience grief from something not like a death of a loved one, but something that's totally unrelated, but it's a shock to their system.
Exactly.
And we personally went through something just recently, you know, that was causing grief, and we're going through it, and we still are going through it, and we've had to work through it. You know, our office in Kingwood was affected by the disaster that occurred last October and that flood. And you know, it was totally destroyed and wiped out, and everything there was wiped out. And so that itself caused different facets of the period of the grief process.
Well, I think you and I noticed, and because we have been working with people so closely, that at the initial stage of the flood, when everyone was flooded up in the Kingwood area, and we were going to meetings and things to determine what was going to happen, it was like a group of zombies entered the meeting.
Everyone was in shock.
Yeah, everyone was in shock, including us,
Right.
and we were able to at least know what was happening to us.
Mm-hmm.
And then as things have progressed, this is now the third month, going into the fourth month afterwards. People have going through their houses, looking at their things, which is the
shock.
searching and pining,
Right.
and still in shock.
Mm-hmm.
And now we're seeing a lot more energy connected to it.
The
People are very
anger stage.
angry
Now
now.
they're getting into the anger stage.
Right.
And then after the anger stage, sometimes comes the stage of depression.
Right.
And so people will go through the anger and then into the depression until finally they can work through it and go back into reinvestment in life. And so that's showing the different stages of grief and how they affect people. Now, what most people don't realize is the emotional and the physical impact of what grief and its various stages can cause them personally. And you know, we've experienced some things, both physical, you know, physical illnesses. When you go through anger or depression, you know, your body creates chemicals, and the chemicals cause you to have certain feelings and emotions that are sometimes uncontrollable, and all kinds of things happen to you. They can literally manifest as physical illness or maybe even a disease of some kind.
Exactly. And what I found over the years is the most important thing is to have some of this normalized for
Right.
people to understand what's happening to them, rather to be in a vacuum and feeling like, you know, what's happening to me, what's going
Why?
on.
Mhm.
And to know that the grief stages are not linear. It's more like a figure-8 process, although they do follow a pattern. It's almost like blazing a trail. Once you've cut out the trail,
Mhm.
it's easy to go back and come forward.
Mhm.
But as you need to regress, you may be in anger, but you may go back to some numbness and denial, which is the first stage.
Mhm.
You may search and pine some more, and then come back to your anger. But Kubler-Ross said the only thing that she really felt bad about in terms of her work was that people had delineated the stages as, I'm here in anger, and if I go back I have regressed and I'm not doing well, when in actuality it's more like a figure-8 process. It's moving backwards and forwards.
But you move a little further forward each time.
Right.
And the reason we're talking about this, and the reason we're explaining a little bit about grief and its effects, is because grief can be assisted using hypnotherapy. And we have found this personally in our own disaster and the grief that we suffered from that. We've also found that in working with a number of clients. We've had many clients that have been in different stages of grief, or who had never had a resolution of grief.
Or did not even realize what was happening to them.
Right.
That they were in the process of grief. And it's, I had already several years ago begun to realize the value of the subconscious mind in working with this.
Mm-hmm.
Had taken numerous classes in art therapy, and had used a lot of art with children initially, and then found adults who were unable to verbalize what was happening to them to use art as a method of communicating their feelings. But I was totally amazed when I used hypnotherapy. I had just begun to really study hypnotherapy and had invested emotionally in a year's process of the minimal study with you. And I was leading a bereavement grief group back with hospice. And one of the women in the group was very teary, which is normal. You know, usually people come into the grief group around 3 to 6 months after a loss. She was very teary, but she was also having very frightening dreams. All of her dreams were scary to her. She was living alone, having these terrible dreams. She was finding that her vitality was waning. Her work was lacking because she couldn't get rest. So I had only taken like 2 classes and had really learned in depth how to give positive suggestion. Had not learned about releasing or anything. So what I offered for her was to do some relaxation. We termed it relaxation. And I offered to give her positive suggestion for improved sleep and improved dreams. And my goal was, if she just relaxes during the 45-minute session, or if she gets one night of good sleep, you know, it's worth my time and her time if she's willing to do it. Well, we set up a time to do this, and we called it relaxation. She came to our inpatient unit, and as we kind of started and I was explaining to her what we were going to do, she said, "Oh, you mean hypnosis?" She said, "I've used hypnosis in the past in my sales job, and it was very effective." And she said, "I had not thought of this." So we began to work, and she went very deep with the relaxation and the suggestion. I was amazed the next week when she came in. She had had very positive dreams. That she still dreamed, and she still went through the process of dreaming as she did, but the dreams had been changed to memory work, which is what positive grief work in mourning is about. And she looked different. The people in the group were so pleased to see how different she looked, and it made a believer out of me. And since then, you and I both have seen miraculous things happen in terms of not stopping the process of moving through the grief, doing the memory work, but helping the symptoms.
Right, and releasing the negative symptoms and the negative effects of it, because they can be so devastating. They can cause all kinds of physical illness, even death.
Right.
Because many times after a loved one dies, if it's someone that you're very close to, many times, you know, the grief process is so severe that you literally will yourself to go on. And I was doing a talk at one of the local healing centers here in Houston one time, and I was talking about the effects of grief, and I was explaining how the emotional effects to the physical body can sometimes be so devastating that they bring on a disease. And I had a gentleman that came to me, and he came to tell me about his experience. And he said that after hearing that and understanding what grief can cause, he saw what the result in his life was. Now, he had had AIDS. He'd been diagnosed HIV positive 13 years before. Now, that was long enough that he was considered a miracle person because he'd had no symptoms. He'd had none of the opportunistic infections or diseases of AIDS, but he was just HIV positive, and yet he was in perfect health. And he had been for almost 13 years. And finally something happened. He had a very strong support system in his life. His family, his wife, everyone was supporting him very strongly. But he had, in his life, he had a dog that he loved very deeply. And that dog was a very important part of his life. And the dog was getting very old. It had gotten to be 12 or 13 or 14 years old or something like that. And the dog died. The dog passed away. When it did, it hurt him, and he grieved so deeply that he intensified the effects of the HIV infection, and he brought on actually AIDS. He lowered his T cell count, and he became susceptible to infections and to a lot of the things that affect a person with AIDS. If it hadn't been for the grief that he was going through, he probably would still be in perfect health today. So we worked with him to help enhance his health, to release and to go through and complete the grief process, and to understand it, and then to, you know, build his strength back and his vitality.
And do the memory work with his pet.
Right. And
in working with children, which you and I both do with grief, pets are often very important. It's unconditional love. And with adults, pets can be very important, as you and I well know.
Right, that's true.
Right.
And we see this all the time. We see so many different aspects of grief and how it affects our lives. People don't understand what causes grief. Now, one of the things that causes grief that everybody knows about is the death of a loved one, a parent or a mate or something. But sometimes the grief can be over just a loss of a lifestyle. It can be a divorce, it can be a separation, it can be a job loss, or it could be something like maybe just a demotion in the job. It's something that you really wanted and focused on in your life. We've seen some other examples of that same thing, the loss of a dream. Remember the lady that
went through the bitter divorce?
Went through the bitter divorce. They were very wealthy and had all kinds of material things, and then after the divorce and her lifestyle completely changed, you know, then her dream was completely lost, and it was, to her, that was a more horrible loss than probably the loss of her husband or her loved one at that time.
Right.
And so those kinds of things, we don't realize the effect that they have on us.
But the subconscious mind is very powerful, and what we've seen in our classes and in working with people individually, it can be reprogrammed. It can be reprogrammed to help release the symptoms, to help people do memory work, to reframe the memories in a very positive way, maybe a learning experience.
And sometimes even to complete the grieving process, to go on through it because they have never grieved.
Exactly.
And we've seen cases of people that have never grieved a loss, maybe somebody that was lost in a young age when they were young and their parent died or something like that.
I think some of the real miracles too have been with the children. I had done grief groups with children, one at St. Martin's Church recently for hospice. Had worked with My Guardian Angel, which was a group that came in from Dallas as a volunteer for like 6 months, and saw real progress with children in experiential type situations. But the subconscious mind work, the hypnotherapy, is very powerful, and we've helped many children who've gone through divorce.
Right.
Exactly. I'll always remember Alice, one of your students, who was always bright, and I enjoyed being around her, but there was some sadness. And in the session that she and I did, some anticipatory grief came up. In hypnosis, her subconscious mind let her know that she had been anticipating the future, and she could not visualize the future without her husband. They had been married a long time. Her son is very debilitated, and her husband helps her with the care of her son. And what came up was that this fear that had been very repressed, she consciously could not have talked about it because she did not realize it was there, came up, and she was able to deal with it, and the dramatic change in her was so miraculous.
It was amazing just to see her, the difference in her from class to class, because she was a completely different person. And we've seen that happen over and over again. If people can understand the grief, can work through it and release it. And with hypnosis, it's a totally non-invasive form of therapy. People don't have to. It's very, very safe. People don't have to remember things that are painful or emotional. They can release them in hypnosis, and then they can go back and reprogram their thought patterns with positive, happy thoughts.
Memory thoughts.
Memory thoughts of the good times, the things that are wonderful and happy about the past. Because the negatives and the few times that things happen that are painful and hurtful, they're far outweighed by the positive.
Exactly.
And so
we've also helped with vitality, because often in the different stages, especially the depression stage, people having sleeplessness, their appetite is gone, their ability to concentrate, to read, to just be there is gone. And through the positive suggestion, helping them to sleep, to want to eat healthy foods, to do proper memory work, then the change is phenomenal.
And we see it almost immediately. I know we worked with a number of people with depression to help them overcome the effects of depression. And in the traditional ways that we've worked with them in the past was to release the reasons for the depression, then to release the depression so that they come out of it immediately, and they can usually stay out of it. Usually 1 or 2 sessions is all it takes to help raise the or release
Energy
the level,
level, yeah.
raise the energy level and come out of the depression. But working with people with grief, we found that the effects can be even more dramatic.
Exactly.
And so it's very powerful. And the depression stage of grief sometimes lasts for a long, long time.
Well, one element that I saw, having worked so many years with death and dying, and to see my coworkers, as a caregiver, as a health care person, the toll it takes on you to see so many people die, to invest in relationships over a period of time causes tremendous work stress. And working with the subconscious mind, having a program of relaxation, a program of positive suggestion, a program of letting go, and framing the relationships in a positive manner, what you learn from these people you worked with, it helps keep people out of burnout.
It really does. And for caregivers and people that are healthcare professionals working with grief, it's one of the strongest tools that they can use. For families, for people that are involved in the process of caring for someone, the burnout is so horrible and so toll-taking. And we hope that we've helped you to understand a little more today about what grief is and how you can maybe overcome it using the tool of hypnosis and hypnotherapy. Grief is something that very few people do understand. And Cheryl, I want to thank you very much.
Thank you.
For more information about hypnosis, call our Birmingham number, 205-322-PATH.